Hey everybody, welcome back to my channel. I hope you're all well. Today I want to talk to you about my latest bout with COVID. I'm going to talk to you about this Paxlovid that my doctor has given to me or prescribed to me this time around. I want to talk to you about some of the things that I'm feeling, some things that I experienced with my first COVID infection back in 2020 that have resurfaced. And yeah, I'm just going to touch base since my last video. I think that was Thursday or Friday when I tested positive. Let you know how I'm feeling, how I'm doing, all that. So first, I'll just get to this Paxlovid. So this is Paxlovid. It is an antiviral. It comes in a bubble pack like this. There's a morning dose and an afternoon dose. This was prescribed to me because I have what is referred to as a comorbidity, which is a cardiomyopathy, which, ironically, I didn't have before my first COVID infection back in May of 2020. Now, with my first COVID infection, 6 weeks after that, I had a TIA or a mini stroke. Doctors feel that that was related to my first COVID infection. And then after I got the first, I don't know if YouTube filters out what people say about this, about the, okay, I had the first two shots and then a booster, and then I had a heart attack. I was out of work. I'm not going to go through that whole thing. Anyways, they think that that was related to either the COVID or, all right, so now I'm taking this to prevent anything from happening to my heart, which has been damaged because of all this. So I started taking this right after, I think the day after I tested positive. Now, it's helping, but it's also scaring me. And what I'm trying to do is just listen to my body. I think my body will know what it needs. But I'm also afraid of something happening. Do you see the dilemma here? Yes. Side effects of this are, what I'm experiencing is I had a severe anxiety attack yesterday morning. Severe to the point where I went out on my balcony, got very nervous, was just pacing around the house or my apartment, went into my son's room, flew his door open, said his name. I said, I don't feel good. I don't feel good. And then I went in my room and I emptied out my sock drawer and took the pairs apart and then matched them together just to get my mind off it, like a distraction. That helped a little bit. I checked my vitals. My heart rate was okay. My blood pressure was okay. But I had also just taken my blood pressure medication, my baby aspirin for a blood thinner, and my beta blocker, which is carvedilol, which I take twice a day for my heart rate. So it was all right. My O2 saturation was maintaining 96, 97, 98, so that was all right. But I know that this is the cause of it. It felt like a poison running through my veins. So I was able to distract myself and calm down from that. This also leaves you with a metallic taste, which I can deal with. I can deal with a metallic taste because you can chew gum, you can have something to eat. It's also causing some GI upset. But what this can, do to you after you run its course is can give you a rebound COVID. And I'm really not looking for that. I've had enough issues with COVID between my first one in 2020 and this one. to not want to have a rebound, which I'm hearing can be even more severe. Now I'm thinking, if it causes a rebound, does this Paxlovid, does it just cover up your infection? And when this is out of your system, your infection is just alive again? I don't know. So I had the 2020 infection, and I had this infection that I have now. But back in October, middle of October, I tested positive for COVID. And I had like some confusion and just not feeling right and a severe headache. So I tested and it was positive. But those symptoms only lasted for like a day or two, and then I was negative. So I don't know what that one was. I think it was just like a breakthrough. But what I'm experiencing now with this infection are all the symptoms that I had as my initial one back in 2020, except for I don't have any confusion, which back in 2020, it was really bad. But what I'm experiencing now is the burning in my nose and the constant smell of cigarette smoke. Now, I did a video about that probably about half a year ago, maybe 3/4 of a year ago, and that is called parosmia. I have seen my neurologist about that. I have gone through testing for it, and parosmia is a phantom smell. It's a smell that's not there, that no one else can smell, but you can smell it. And what I smell is cigarette smoke with a burning and a headache. Now that has been gone from me for a while. Probably about 6 months, 9 months, it's been gone, but it's back now. I have this really bad burning in my nose, and all I can smell is the cigarette smoke. So this bout of COVID has brought all that back, and it's very disturbing. Some people report smelling things like rotting meat or having everything taste foul or distorted. I have not lost my sense of smell or taste with this infection. Cross my fingers yet, and I'm hoping I don't. But what I'm experiencing again is just the smell of cigarette smoke. And it's disturbing and it's discouraging. I'm feeling a lot better, and I don't know if it's because of the, I keep showing you the wrong side, this Paxlovid or what. But I don't know if I want to keep taking this and just let nature take its course with my body. I don't know. I really don't know. I'm not a fan of what I'm going through. Where I got this case of the infection this time around, I don't know. Did I run into someone at a store Christmas shopping? Did I say hi to somebody? Is it going around where I work? I don't know. Yes, there are some cases, but I wasn't in contact with anyone that had it. I wasn't in contact with a resident or a patient. I don't know. But yeah, I'm going through this again. So I'm just talking about my infection this time around. It helps me. I'm talking about this Paxlovid. While it does help, they say I can have a rebound infection I'm not looking for. I don't know what the answer is. I'm a little congested, not as congested as I was on Thursday or Friday. I honestly don't know. I don't know. I think what I'm basically trying to do is to help anybody that might be going through this right now. This will end. This too shall pass. But the fact that I have this again, this cigarette smell in my nose again, where it took almost 3 years to go away, this isn't anything I'm looking for to deal with. My neurologist, another ironic thing, my neurologist prescribed a medication, a headache medication that could help with these smells that I get, these phantom smells. But a side effect of that medication is heart palpitations. I take medication so I don't deal with that. Do you see my battle? Do you see the whole circle that this goes in? This virus and what it can do to you is terrible, is terrible. Now I know that so many people are tired of hearing of COVID and the virus, and it's old news. I'll tell you what, it's not old news. Yes, there are shots or whatever that you can get to ward off, but there are people like me and maybe like you or someone you know that have dealt with the long hauler, long-term COVID effects or side effects or damage. And when it comes around again and you get sick again, it just opens it all back up. And guess what? It's still out there. Their variants are still out there. And it's not going away. If you are one that just had a quick bout of this and no damage, I'm happy for you. But myself and other people out there had an initial infection when there was no help, when no one knew what to do. And currently I'm feeling like, I don't know, what do I do? Do I retire? Do I take retirement early? Do I take a disability? Do I get out of health care? I don't know. No, I don't want to, but I do want to enjoy the rest of my life. You know what I mean? Yeah. So I'm just letting you know that the doctor has prescribed this. Do I want to keep taking it? I don't know. Do I want to trust God and let him do what he feels he needs to do? I'm not turning religion into this on my channel or this video, and I'm sorry, but that's just, I do have a strong faith. Do I trust my body, or do I continue taking this approved for emergency use to ward off any further damage? I don't know. I don't know. But you know what, guys? I'm going to live my life. I'm going to continue to quarantine. I'm going to probably test on Tuesday or Wednesday and hope that it's negative so I can get on with life and I can leave my house. I'm going to get out there and get some fresh air, I know that. But here we go again. Here we go again. So, today is New Year's Eve. I'm probably just going to clean up my house a little, take down my tree tomorrow. Maybe I'll do a little video of undecorating and getting my house back to normal. But I just want to touch base with you and let you know where I'm at. I'm sure some of my regular subscribers or viewers or even people that came across my "Oh no, COVID again" video are probably wondering where I'm at right now. I'm doing okay. The more I talk, the more discomfort I feel. So I'm just going to end this video and wish you all well, and I will talk to you soon. Happy New Year. Be safe. Whatever you do today, be smart, stay safe, and stay healthy. I'll talk to you soon.